right, well, welcome everyone. Happy Nurse Practitioners Week to everyone. My name is Dr. Audra Cave. I'm the Clinical Director for the Department of Family Nursing here at Frontier Nursing University. We're excited to be here tonight to talk about improving the health of rural Americans. We know that nurse practitioners are vital to providing health care in our communities, but particularly in our rural communities. So today we're excited to present a panel discussion on improving the healthcare. And with us tonight, we have representatives from the Family Nurse Practitioner Department, the Psychiatric Mental Health population, as well as the Women's Health Nurse Practitioner population. And in that we have Dr. Joanne Keefe representing the FNP population. We have Sue Schaefer representing the Women's Health Nurse Practitioners, and Dr. April Phillips representing psychiatric mental health. And I'll let you guys speak to your experience. Dr. Keefe, would you like to go first?
Absolutely, thank you. So I'm Dr. Joanne Keefe. I live in a frontier area of New Mexico, and I'm a family nurse practitioner and an epidemiologist. I teach in the epidemiology and biostatistics course here at Frontier. I think my experience is just lived experience, both as an epidemiologist in New Mexico and then working as a provider now in this frontier area where I see firsthand the issues that my patients have, my neighbors have, and working hard to try to work on systems that will improve healthcare access. And it's absolutely heartbreaking when you realize the disparity that's in a rural environment. Thank you.
Thank you. Ms. Schaefer?
Yes, I'm Sue Schaefer and I'm from Iowa. So I live in a little town called LeClaire, Iowa. So it's kind of a little rural town. I do work more in the urban areas, and I have been there 30 plus years working in women's health, doing obstetrics and gynecology. So I see a lot of the disparities in the rural areas that we have, such as transportation is a really big one, getting people into our clinics and things like that. So I enjoy what I do. I've been there, as I said, 30 plus years and hope to continue many more.
Thank you. Dr. Phillips?
And I'm Dr. April Phillips. I am the Clinical Director of the Psychiatric Mental Health Nurse Practitioner Program here at Frontier Nursing University. And for the vast majority of my career, I have really focused upon the provision of both family and psychiatric services in underserved rural communities. The focus of my doctoral project involved the development of an integrated model of healthcare that was designed to increase accessibility of mental health services in the primary care environment within a rural mountain community. And of interest, I also worked with the National Health Service Corps for many years. I actually served in a frontier area of New Mexico, not far from where Dr. Keefe lives. There was a hitching post outside of my clinic door, and people did use it. And I even had people that drove upwards of 100 miles to see me for primary care at that point in time. And that really inspired me to go on and obtain the psychiatric certification, just out of my passion to serve those communities. Thank you for having me.
Thank you. Wow. Lots of experience in this room tonight. So as we can see here, according to the U.S. Census Bureau, a large part of our population is considered in a rural area. 15% of the population, 46 million Americans, are considered rural Americans. And, you know, that is a big number. That's a big number to provide care, adequate care for as well. And there, as you'll see, there's certain challenges to providing care in rural areas. Next slide, please. So the first thing I'd like to talk about is, what challenges do you all see that your patients encounter concerning access to healthcare? And maybe have you seen healthcare infrastructure depletion as part of your practice? And we can start with Dr. Phillips.
Thank you so much. So there are many challenges that our patients face in rural areas. I'll just go ahead and speak to the mental health realm because we've got such a great panel of experts here that can speak to their own areas of practice. I know in my own rural area where I reside in southwestern Colorado, a great challenge is the provision of mental health services and obtaining psychiatric services for our pediatric and adolescent population. For example, if we do have an adolescent client who is in need of inpatient services, they may be sent via airlift or ground transportation as far as 8 hours away, which becomes incredibly difficult for those families to provide support for their young children. And that goes for, primary care and other forms of care as well. We do know that the mental health needs in our rural communities are very few and far between. And I would say that this depletion of services in those areas is directly related to our incredibly high suicide rate in rural areas. We know through recent research that the suicide rate in rural communities is twice that of other communities in the United States. So that's alarming, and it's certainly something that we need to focus upon.
Thank you. Ms. Schaefer?
Yes, and I serve the more obstetrics and gynecology, so I don't do the mental health as much, but we see a lot of that going on in our clinic as well. But probably transportation is a really big issue for a lot of our rural patients, is just getting to our clinics, because our clinics are more urban located and buses don't run out to these rural spaces. So just, having to work with our patients on what time is going to work for them, be accommodating to them. If they're late, understanding why they're late, not sending them away, not trying to not see them for the day. I mean, a lot of our patients are underserved population as well, so they need much more health care as far as some of the other women we see. So they may need ultrasounds every time they come in. They may need NSTs they come in. So we just have to be really understanding of how we take care of these women. And I mean, as far as our hospitals as well, those are all in our urban areas. So we're talking sometimes, it's a half an hour to an hour just to get to the hospital, just for deliveries or for emergencies. So again, and not all of our rural areas have ambulances available. So some of them have to call medic from another town to get to this town to take them to another town. So transportation and getting to where we need to get sometimes is a really big issue with us.
Yes, absolutely. Dr. Keith?
Thank you. I can build on that EMS piece, and then I'll circle back around to some other challenges. So my county is 6,900 square miles, and we have 3,800 people. That's about 0.5 person per square miles, according to the census. So what I'm finding is that we don't have the infrastructure, we don't have the people to support any sort of things that we want to do. So the biggest challenge that I see from trying to provide care and increase access to care is that we don't have enough nurses, we don't have enough CNAs, we don't have enough EMTs. In my town, we have one EMT per town across the northern part of the county, which is about split in half. And those people are on call 24/7. And sometimes they go away, and then we have to use people from other towns to come and pick up someone, which means that EMS, this is an unpaid, a volunteer position, EMS response could be an hour to an hour and a half before you get someone in an ambulance to take you for another hour, hour and a half, depending on where you live in the county, to the nearest hospital, which is just also a very tiny hospital that just mostly flies people out, or else they send them right to be flown out. So sort of really emergencies aren't being seen in a timely fashion. That's just reality of our EMS here. We have poor older complex health issues in our patients, decreased transportation, substance use issues as well. In my county, we do not have cell coverage throughout the county, which is a huge challenge. So like I said, the quickest ER is over an hour away, and it crosses state lines in order to get there, which means that there are insurance issues sometimes to access health care, or people take a flight out. We have no emergency systems. We have no maternal health systems. When I first moved here over 3 years ago, we had no home health or hospice in the entire county. Um, and we have one primary care provider who splits time between two different cities in the county, towns in the county. And within that, there's a social worker who provides counseling on a very limited basis and then provides telehealth access and walks out of the office if someone needs to have mental health management, medication management. So there are a lot of challenges where I live, and it's sort of mind blowing. I didn't realize it when I moved here, how all encompassing this could be. Thank you.
Thank you. Next slide, please. So we touched on the very topic on this slide here, that rural Americans face health disparities probably much differently than their urban counterparts. Statistics have shown us that health disparities within the rural healthcare setting is a heavy burden on chronic disease and chronic disease management. There's a higher percentage of unintentional injuries. We've touched on substance abuse, maternal mortality, especially with the lack of infrastructure in rural settings, more ICU admissions and mental health disorders, as Dr. Phillips had addressed as well. Next slide. So what strategies do you utilize to address the healthcare challenges in your rural settings? And we'll start with Ms. Schaefer.
We actually have started doing telehealth, and that unfortunately came about when the COVID came about. That really pushed us into doing telehealth, but we didn't realize what an asset that was going to be for all of our patients in the rural setting as well. So telehealth is something that's become very strong with us in the last few years. So that is something that we've been doing. Trying to find transportation, either some insurances will pay for their transportation for us, or we raise funds to maybe pay for a transportation to and from their appointments if we need to. We can do things like bus tokens, but obviously that is just within our community. It doesn't hit us out in the rural settings at all. So those are some of the things that we are trying to work on.
Very good. Thank you. Dr. Keith?
Thank you.
Yeah, so in my county, we've developed a team of people, mostly healthcare providers, but not all, just interested parties who want to talk about this. We created a 501c3 and seek grant funding to try to improve access. It helps to spread out, trying to do these interventions to have more than one person lead it. So we actually got organized and did that. We got a hospice care agency to come this spring, and that was after calling around to different agencies and asking them to come. And so are working with that. But we are turning people away at this point because we don't have enough RNs and we don't have enough CNAs. And so we created a CNA program within the community to increase the number of CNAs that we can use that can then get hired by this hospice agency, and perhaps if we can grow into a home health agency, that will have the CNA support for that. We've gotten together and got funding for life alert necklaces for people in need, so that we have some sort of a safety net for people who are living alone. We have a lot of older folks and a lot of people falling and dying because of that. And so we're hoping that that will help things. We are working with some real basics, community phone trees, buddy systems, to make sure that people are okay and they made it home in the snow and they're safe, or they, talk to them every day and make sure everybody's okay. We have some issues with insurance. So we're trying to get more people to sign up, and we're getting more people to look at their Medicare, as particularly Medicare plans every year. So bringing someone out to work with them on that. And I appreciate that telehealth works in many areas and is a godsend. Um, uh, for our area, I have to emphasize that not everybody has cell connection. Different, I mean, eh, between town and my house, I don't have any cell connection. I mean, that's how sparse it is. Many people don't have a computer. They don't have transportation to get to a computer, or they can't use the computer. And so we have some real challenges with telehealth that we haven't been able to rely on that as much. But the others are strategies we're trying. Thank you.
Thank you. Dr. Phillips.
Yeah, I'd like to speak to this not so much from my personal residents, but more on a broad level and some of the exciting things we're doing through the psychiatric mental health program here at Frontier. We know on the whole, there's a huge challenge, as Dr. Keefe had mentioned specifically, in bringing those providers to the area in those rural communities. Who may not have the technology, right? We think we tend to look to telehealth, particularly with to meet those psychiatric needs, and not all of these areas will have that type of bandwidth, literally. We know that over 70% of psychiatric providers reside in urban areas. So that's a very, very difficult challenge when we're looking at, fewer than 30% of our psychiatric providers residing in rural areas. In like manner, we know that 80% of psychologists and social workers also reside in urban areas. So a big, big challenge here is how do we bring those providers to these underserved rural communities? There's a phenomenal project that we've partnered with within the psychiatric program. And the name of the provider is Mountain Comprehensive Care Center, and they're located in Eastern Kentucky. And this is an area that not only is very rural, but also has some geographical challenges with mountains and access to certain areas and communities. They have effectively developed a network of systems to provide specialty care. It's pretty phenomenal what they're doing in Eastern Kentucky. They've actually developed an inpatient pediatric and adolescent unit to meet the needs of those clients in that specific population. They're doing some pretty incredible suicide prevention work. They have a whole network of clinics where they have effectively integrated mental health services into primary care. And they've really developed a system where providers can go from different clinics different days of the week. So it helps with the provision of the mental health services in particular. One of the exciting things that we're doing through the psychiatric program is I'm currently working with a HRSA grant, the Behavioral Health Workforce Grant. And this is really designed to help bring students to rural underserved communities and really help them to go to those communities, fall in love with those communities, and stay there and provide this greatly needed care. So through this partnership, we're looking to bring students to those communities, break down a lot of the financial barriers regarding housing and costs during their completion of their clinical hours. And through this partnership, we'll be able to provide housing, and all of our students will effectively be able to work in a number of these different rural sites and get a different perspective at a variety of different clinics and units and things.
Thank you. That is a really great strategy. I think there are a lot of clinical opportunities out there for students in rural areas where they could practice and like you said, fall in love with the area. A lot of times they want to stay there and work there, and that's a great option. Next slide, please. All right, some of the factors that contribute to increased health disparities. We talked about this a little bit in earlier slides talking about infrastructure, but hospital closures, maybe closures of obstetric services in rural areas. We've spoken about transportation, the high rates of poverty, and really we talked about the insurance as well. Like there's a higher rate of not only uninsured, but underinsured in these underserved areas. Next slide. So I'd like to talk a little bit more about what communities can do to address these challenges in their rural settings. How can we come together to address this as a community? Dr. Keith.
Thank you. One of the things that I really want to stress is that we need to talk about equity instead of equality when we talk about rural settings as an underserved population. So visiting people takes longer, and it takes more of an effort for the patient to get to the clinic. The model of seeing patients in 10 or 15 minutes, addressing one problem and having them come back, it doesn't work in a rural setting. And we need to acknowledge that there are some differences that we really need to address. Their travel takes longer. We're not going to see the same number of people in one day, but people still need to be paid for their time. In fact, I would say that in order to bring people into the community, we may need to think about paying them more for being in an underserved community. And they will see fewer patients, but they're going to have different challenges that we really need to address. And I want to talk about loan repayment. I'm a big fan of loan repayment. I think it's a great way to bring people into rural settings. However, I think we need to be a little more thoughtful about how we do that. And that is just lies in the fact that we take oftentimes, and this is what I'm seeing in my community, we'll take a new graduate and bring them into this rural community without a mentor and without appropriate support. And then we expect them to function as a fully functioning NP. And it's not fair to the provider for sure. They need to know where they can access assistance, and they need mentorship. They need someone to call when they don't know what to do. I'm a big fan of first jobs should have a very strong support system so that the new provider can learn what needs to happen. Well, we don't have that in these rural communities. So we need to create a structure outside of that that supports them in that way. So the other thing that happens then is that the rural community who goes and sees them loses faith in them, and then they stop going to the clinic. So we have a clinic that people are not going to for care, which is a major problem. So it's something that I think communities need to really think about when we're addressing this. One of the things I want to bring up here is that Project ECHO has a great model, ECHO, that's out of University of New Mexico, but it's all over the world now, has a program that does support people in rural settings to do different specialty care, including primary care. But other specialty care. So that's something that's free and that rural providers can access to get the support that they need in that way. But I really think that this is something we need to address in terms of bringing loan repayment and bringing new providers to communities. Okay, I'll stop there. Thank you.
Thank you. Dr. Phillips.
Well, thank you so much, Dr. Keith. Just to really piggyback on that, I am currently a National Health Service Corps ambassador. So that means I speak to a number of different professionals about the program and work with medical students, dental students, PAs, NPs across the board, and really talk to them about the benefits of the program. So above and beyond the loan repayment, we really need to develop systems. And I've worked with a number of members of leadership with National Health Service Corps in how do we not only provide that loan repayment, but also provide supportive mechanisms for students and new graduates in those areas. And that has resulted in a number of different mentorship type experiences. Currently, the National Rural Health Association also has a National Health Rural Health Fellows Program. This is something that I see as being very vital, and certainly this is something that we could work to develop specifically for our nurse practitioners as well, to provide that support in rural areas, because this is what nurse practitioners do. This is what we do in advanced practice. We come forward and we meet that need in those underserved populations.
Absolutely.
And yeah, and just a further comment I wanted to make, I see a lot of really highly qualified candidates apply for the loan repayment program. In my mind, this should be something that's very readily available. Many other nations like Mexico provide this to their medical students and graduates. If you are if you would like to work in an underserved rural community and you choose to do so, then your loan should be paid off. Unfortunately, there's a very limited availability within the National Health Service Corps loan repayment program, and it's highly, highly selective. I would like to see that expanded tremendously, and that would make a big difference in increasing access to care in our rural communities.
Yes, it would. Policy opportunity there. Ms. Schaefer?
Yeah, and I kind of like to piggyback off a little bit of talking about just not being the traditional 15-minute kind of time slots. Whereas if we can get a patient, and I work for an FQHC, so it's the Federally Qualified Health Center. So we fortunately have all of the services there. We can have the women's health, the OB-GYN, we can have the family practice, we have the psych. So we kind of have it all. So if we can see multiples in a day, then that's something we need to do at times. And granted, some insurances don't appreciate us doing multiples in a day, but we do what we need to for our patients, because we unfortunately don't have a lot of clinics in the rural settings. We do have them in several different counties around us, but they aren't all rural. So we still have the trouble of getting our patients to these. So once we get them there, if we can do multiple visits at a time, that really will help them and get as much done for them in that visit or in that time slot that we can do.
Yeah, that sounds like a really exciting way to address the need there. Next slide, please. So talking about access to care, the access to a physician is easier or greater in urban areas. Patient to primary care physician ratios in rural areas, look at this, 39.8 physicians per 100,000 people compared to 53.3 physicians per 100,000 people in an urban area. Next slide, please. So what can nurse practitioner students do to better prepare themselves as they're going through their journey, through their education, to address the challenges providing healthcare in a rural community? Ms. Schaefer.
One thing I say is, and I know you guys have a lot of students because we do have some of your students come through our programs, is to try to get them into programs such as ours, the FQHCs, the ones that see the underserved, the rural areas, and getting them out there to know, to better prepare what they can do once they are done with their programs.
Agreed. Thank you. Dr. Phillips?
Yeah, thank you so much, Dr. Schaefer. It's so important to expose our students to those opportunities. That's really key. And I ideally would love to see a course within all programs in a curricula that addresses the needs of rural health. I know that the University of New Mexico has a number of innovative programs and courses that they offer to medical students in particular, but it would be wonderful to see that type of offering for our nurse practitioner students as well.
Thank you. Dr. Keith?
So one of the things I would do is advocate that you make sure before you take a job that you have that support. Make sure you have a mentor or a preceptor or somebody who's going to take you on when you graduate and take your first job. So that's, I think, really important. Then advocate when you're taking it, when you're sitting in the interview, advocate for the decent appointment times. It's not going to work with 10 to 15-minute appointments. Set it up right at the beginning that you're going to need more time, working, because this is a different population. Get your resources lined up as soon as possible, because this is a lot of networking that's required in a rural clinic, and even more I find than when in a suburban or urban area. So you need to know who you can call for advice for your own self so that you can make appropriate diagnoses, but then also who can you send people to, who can you run things by, what's around to help people with nutrition, what's around to help people with insurance. Like, knowing all your resources, get that as soon as you can. Be ready to work with others. Networking is really important, and it's going to be a lot of figuring out who in the community is going to help you to improve the goals that, the healthcare access goals that you want to meet in your job. Meet with the community. Please participate in community activities. Let people get to know you. There's a lot of trust issues that come with being a provider in a small area. Let them see that you are part of the community, and let them get to know you, and be 2 ears and 1 mouth, right? So listening a lot to what people want, and trying to help address that. Go in the direction that your community wants to go in. Don't go in with your own ideas. I'd say advocate on a policy level, partner with your representatives, let them know what's going on in the rural communities. They tend to get, I find, very focused on the loudest voices, which tends to be the most voices. And so being loud from the rural community and having that partnership on a policy level, I think, is really important. And the last thing is think big. Think about big systems. Think about transportation, insurance, access to nutrition, communication, how that all truly works in your area. What do you really have going on there, and what do people need? So don't just stick with the individual patient and what you can provide to them, but thinking about your community in a systemic way, and how you can address some of those other issues. Thanks.
Thank you. Thank you for that. And I would like to piggyback on that a little bit, just to say, embrace the opportunity. It's a fantastic learning opportunity for students, because you not only will be challenged in the diagnostic and clinical things that we do learning this role, but also you will become experts at resources and how to manage resources, which is a key skill for nurse practitioners, because we are always finding, utilizing, managing resources. So I think that's really important. And another, one more thing I would add is get to know your rural health organizations. There are rural health organizations all across the country with resources, not only like food programs and things like that, but also educational opportunities for the healthcare providers that are in the area. So look for those if you're able to get out into a rural setting. Next slide, please. All right. Thank you. This has been a delightful conversation. It's something that's near and dear to my heart, because I've provided rural health care in an FQHC for the last 15 years, and the patients are truly a joy to get to know and work with. We've talked about a lot of important things tonight, healthcare barriers and challenges, but also some solutions, right? And some encouragement to get out there and try it. Any final thoughts for any of our panelists?
I would say, if you find yourself as a provider, particularly a new provider in a rural underserved community, be brave and look to innovative strategies to bring that care to your clients in need. Oftentimes it doesn't have to be a high cost intervention, but there can be some community level interventions that can make all the difference in the world.
Absolutely.
And I'd like to add too that I totally agree when they were talking about getting out into the community. We have so many events in our community, whether it's for school age children or it's for adults or what it's for, but getting out into the community and getting into those events has just been a tremendous help to us and to our patients. At least we can reach some of our patients that way. And then getting into the school systems as well, you know, trying to get into the high schools and, you know, reaching some of our patients or students there that we can talk to about anything from becoming nurses to nurse practitioners to where they can go for good health care. Sometimes is really important in our area as well.
Yeah. I love all that. And don't forget about your about public health, because there are a lot of initiatives that come out of the Department of Health and your different public health agencies, and out of like your public health association that may be in your state or on the national level. So thinking bigger, thinking about all the partners that you could possibly bring in. There are people who have solved some of these things. You don't have to start from scratch. And then be humble, love your community, and do the best you can for them. And with that heart behind it, you will be a fabulous asset, bringing health and thoughtfulness to your community. And it's very exciting, neat, really neat place to work and a place to be.
It is for sure.
It is.
Well, thank you to our panelists for being here tonight and sharing your expertise. I bet you have sparked a passion within somebody tonight. And I also want to just say Happy Nurse Practitioner Week to everybody. The work that we do is so incredibly important. So I want everybody to take some time to celebrate yourselves, celebrate your colleagues, and know that we make a difference out there as nurse practitioners.
Thank you.
Thank you. Good night.
Good night.
Thanks so much.
Thanks, everyone.
Thank you.